Hi there viewers, it's Dr. Mashhood again with a video on CBC. Today we're going to talk about CBC, also known as complete blood count. In certain part of the world it's also been called as full blood count or FBC. The importance of CBC or FBC is that it's one of the most important tests and most simple and most widely used tests around the world. It can be used for multiple reasons. The first one is it could be done as a routine screening or health check for all the patients or general population. It could be done yearly. It's recommended that patients who are people who are above 40 years old should have the CBC test done once every year. The second important reason for doing CBC or FBCs are it can be used as a very important test to diagnose certain medical conditions such as anemia, infection. It could be diagnosed for certain types of cancers such as leukemia. It can also give an indication whether the patient is having a bacterial or a viral infections. The third most important reasons for a CBC is it could be used to monitor the progress of a medical condition or a disease. And the fourth one is it could be used to monitor the progress or the effectiveness of the treatment. Now, CBC or FBC consists of several components. The report will show up at least 10 to 14 components. It could be higher, it could be lower, the number, depending on the analyzer used by the laboratory. But as a rule, as a general rule, at least 10 to 15 or 14 components are shown up on the CBC report. Among these, 6 or 7 are the important ones. Among these 10 or 14 components, 6 or 7 ones are the most important ones which we're going to focus about. We're not going to go into too much into the medical depths of this because we're going to keep it for the general population. But so the first 6 or 7 components of the CBC report, which are the most important ones. The first one is the WBC or the white blood cell count. The second one is the hemoglobin, or normally called as HB. The third one is the platelets. The fourth one are the different types of other types of WBC, such as lymphocytes or eosinophils. The other ones could be such as the red blood cells. Now we're going to talk about each and every component, the 5 or 6 components which I've just mentioned. The first one, the all-important one, is the WBC or the white cell count. If a patient is having a normal WBC count, that normally suggests that there is no infection in the acute phase. It has been seen that patients can have normal WBC count, but they can also have infection going on for more than 2 or 3 days. If the WBC count is higher than the normal reference range, that normally manifests or tells us that there is some infection going on. Along with the WBC, as a marker for looking for infections, we normally use figures of the lymphocytes or eosinophils. Both of these, the lymphocytes and eosinophils, are the subset of WBC count. If they're high, it normally represents some type of infections. The lymphocytes are normally raised in the viral infection, whereas the eosinophils can be raised in both viral as well as parasite infections. However, if the lymphocytes are raised in a very high proportion, then we need to think about certain serious conditions such as leukemia, which is also commonly known as blood cancer. Similar goes for the most important one is the hemoglobin, or normally called as HB. The HB count varies whether you are a male or a female. In males, the normal reference range is above 12. In females, above 11 is a normal range, depending on which analyzer the laboratory is using. If the hemoglobin count is low, it normally represents either patients having anemia or they are having some sort of blood loss. But if we suspect patients having anemia, Then we look at the other component of the CBC report, which is called the Mcv count. Hemoglobin and Mcv count are normally looked at together. If the hemoglobin is low, then the next thing which will trigger us is to look at the Mcv count. If the Mcv count is also low, that normally represents patient most likely has anemia. Now, apart from the WBC, eosinophils, lymphocytes, hemoglobin, and the Mcv, the other most important one is platelets. Now, the platelets are normal if they are above 150,000, but that reference range will depend on the laboratory parameters. Let's presume if the platelets are high. If the platelets are high, more than the normal range, then it might represent infection. However, if the platelets are low, then that's something to worry about, because the causes of low platelets are multifactorial. They could be low in a cancer patient who's having either chemotherapy or radiotherapy. They could be low in anemia, or they could be low in liver problems because blood is not being able to clot itself. The platelets are very important, and now platelets are normally used by the body if there is some bleeding. If the bleeding happens, the platelets come together and form a clot so as to block or prevent any further bleeding. Just to summarize, the WBC, the CBC, or the FBC normally has at least 10 to 15 components, but out of these, 6 to 7 are the important ones, which are the WBC, eosinophils, lymphocytes. The 3 of these can represent infection. Then comes the hemoglobin and the Mcv, which can represent anemia or blood loss, and then platelets, which can represent serious conditions such as liver problems, bleeding tendency, or cancer. Now, the important things, the 4 or 5 important diagnoses you can make straight away by looking at the CBC report. The first one is anemia, when we look at the hemoglobin and Mcv. The second one is whether the patient is having infection. In that case, we're going to look at the WBC, eosinophil, lymphocytes. We can look at bleeding disorders. For that, we're going to look at the platelets. If we suspect somebody is having cancer, or a blood cancer to be more specific, then we look at the numbers of lymphocyte, eosinophils, WBC. In that case, it could be either very high or it could be very low. One last important one is neutrophil. Similarly with WBC, neutrophil is also used as a marker of infection. The description of all of these is present in the description below. Whatever we talked about now, I've summarized it in the description just below the link. Please have a look, go through these. If you have any questions, please let us know by your comment, and please don't forget to subscribe and like this video. Thank you very much.